Hello, and welcome to Rejuvenature. This podcast is dedicated to helping you find health in this toxic world. I am Dr. D.K. Geyer, and I will be the host for this show. Okay, hello, and welcome. It is my pleasure to introduce Dr. Robert Fiss. So thank you very much for joining us today.
Well, thank you for having me.
You are very welcome. Dr. Fiss is a graduate of Palmer College of Chiropractic and has had his own practice for over 30 years. You are beyond being an expert in the field.
I guess. I'm a survivor.
Well, we have a couple questions for you today. And when thinking about chiropractic care, many people associate it with twisting their back while they're shoveling snow, or maybe they've taken a tumble off a bicycle. But treatments address so many other health conditions. So can you just tell us how chronic health issues, such as a weak immune system or kidney function, can be helped through chiropractic services?
Yeah, so the most important thing to know when you're trying to grasp the benefit of chiropractic is that the chiropractic science and treatment is the correction of nerve dysfunction. So if you think about the nervous system, it regulates everything, including the areas you're talking about. Your gut are so important to your immune system, for example. If you don't have free of interference nerve flow, then you're going to have a range of opportunities for problems to occur. Although we have patients that ask about these conditions, which I'm always welcome to address, the reality of it is it's easier to look for anything that could be interfering with the nervous system associated with the body. Try to normalize that using the standard systems we use for chiropractic care, and then remeasure how that person is doing in that area. Other things that could obviously be occurring would be nutritional. And if you're just doing the nutritional part, but there's nerve interference associated with it, it's not going to be a complete correction, or at least as complete as you'd like it to be. So a host of different conditions, if you want to call them conditions, or areas of the body that can be addressed through addressing the nervous system.
Cool. Thank you very much. I recently read an article in U.S. News and World Report, and it was titled Surprise. Chiropractors can treat these 5 conditions. Now, it reported that in a clinical trial conducted at Macquarie University, 72% of migraine sufferers experienced either substantial or noticeable improvement after a period of chiropractic treatment. Would you be able to elaborate on that information for us?
Sure. Considering what we talked about just a moment ago, if we look for the source in a structural component such as the spine, the 24 moving vertebrae that support our body upright against gravity, and the innate relationship with the nervous system, certain areas of the spine are going to be more contributing to different areas of problems. So the upper cervical vertebrae, first cervical, second cervical, are key areas to look for any headaches, particularly migraines. The lining of the brain inside the cranium is dura mater, and dura mater runs all the way down through your spinal column, attaching to several areas or several vertebrae along the way. Those vertebrae, when misaligned with, have the ability to put torque or tension on the dura mater, which can change CSF or cerebral spinal fluid, pressure, flow. Additionally, just local to the alignment of C1 and C2, you've got blood flow to the brain as well is critical. Anything creating loss of normal motion position in those vertebrae, holding up the weight of your head, can easily distort the way the circulatory system and the cerebral spinal fluid circulation works, contributing to headaches. I frequently address the idea of treating a specific area such as, or condition such as migraines, by saying, what I want to do is find the source of any spinal distortions, correct those, and see how that changes. Many people customarily see their physicians for migraines, as they should. Physician might run a CAT scan or an MRI of the brain, make sure everything's clear there, and then proceed through treatment under medication to suppress those symptoms. And those symptoms can be, in some people, as often as 4, 5, 6 times a month, which is quite frequent, normal to them, frequent to everybody else. And the medication is designed just to alter and change it. Whereas if it's changed by adjusting the spine, then most likely that's the cause of the problem.
Right,
If
addressing the cause.
if it
instead
makes
of
a
the
change,
symptom.
then it's got to be related to the cause. So it might be something that needs to be addressed on an ongoing basis as the patient sees a change in their symptoms. It's also important to bring up, along with that, that two people might have an upper cervical subluxation, which is the misalignment causing a loss of normal motion position, interfering with the nervous system. But they might have two different classifications of symptoms from that. So not every upper cervical subluxation causes migraines. And so it's really important to use those patients' symptom package, if you will, to help narrow down what we're looking for. But ultimately, in my practice and in my technique of chiropractic, we basically look at the entire spine and how it relates to itself, make the corrections, normalize the whole thing, and then look to see how the symptoms have changed along with the progress that they've made objectively. So,
Yes, and it seems to be working very, very well. Has the increased use of electronic devices created posture-related health conditions? I've noticed some of them. You can look at somebody who's 14 years old and they already have a different stance or posture from looking down all the time. So what advice do you have for avoiding this issue for both children and adults?
that's a really good question. And it probably would be best to just address posture overall prior to phones and iPads and gaming systems, even for children. Most kids that had look down posture were maybe bookworms reading books all the time, which isn't the major majority. Other kids were just really active. So as they grew and matured, the ones that typically had bad posture were ones that were trying to hide something. They were maybe the tallest one in the class and they wanted to come down to everybody else's level. And that started a process of bad posture. And you're right, now you're seeing it almost across the board with everybody, not just the tallest in the class, using devices. And I've been in my treatment room and mom brings in their 4, 5, 6-year-old and they sit curled up in the chair constantly looking down at that phone, and I see them and it makes me wonder. Of course, I've practiced a long time, but those that are practicing now for the next 38 years, what they're going to be seeing with this population that's kind of unaware. Which brings me to the posture point I want to make, is postures is something that we're completely unaware of. You can't see yourself and your own posture. Only those that look at us can see our posture. Unless you're aware of it by moving your body into a more upright position and saying, wow, I just moved a half an inch or an inch and a half from one position upright to a stronger position upright, you really don't know that you're slouching or slumping or whatever you want to call it. One of the things that just blows my mind is when I go to local box stores and I see healthy adult, young to middle young age adults, and they're leaning on their grocery cart as they're pushing it through the store with their forearms. And I'm thinking, why can't you stand up straight and push it with your hands? And even for those that have weakened postures and know they do, more of an elderly group, it's a great exercise to walk one aisle standing up straight as you can, and then the next aisle, maybe take a break and rest and lean on the cart and push yourself through it. But don't push yourself through the entire store. And posture is one of those things that we're going to lose the battle to gravity. Gravity will suck us to the ground. It's just a matter of how quick you want to let it happen. You're losing a battle to gravity. And once you get past a tipping point, there's no return. It's very difficult. I'm constantly letting people know in the practice, young, middle, and older, if they have the ability to rock their body upright, straighter, then it's an exercise in itself. And I almost thought, I forgot a really strong point of this. I see a lot of people when I'm driving back and forth to work that are walkers. They're outside walking. And they get to a certain age group of people, maybe 50s, 60s, early 70s, where they're looking at the ground literally 2 to 3 feet in front of their feet or toes as they're walking at a brisk pace. Again, listing or leaning forward at the waist with their heads pointing at the ground rather than looking up at the horizon. And I'm aware that they do that because they don't want to trip and fall on something, but we could all look further ahead of us. We could say, hey, there's something coming at me. When I get there, I've got to deal with it, rather than looking at it at the points of our toes the whole time, weighting ourselves on our toes and affecting our posture. So when you exercise, whether you're walking in the neighborhood or you go to the gym and you're pushing or pulling or lifting weights, if you correct your posture through those exercises, you'll strengthen the small intrinsic muscles that attach to your spine that create your ability to move upright into posture. They're the smallest muscles. They're not the big, large muscles everybody thinks about that are on the surface. They're very deep. They're against the spine, and they allow us to straighten our bodies upright. And if you contract those along with the exercise you're doing, you're actually exercising them. And if you don't, you're not exercising them, and you're not targeting the areas you're trying to exercise. So posture's key, and it's going to be a big problem for the kids for sure.
I agree, and thank you so much for that. That's like $1 million advice in 3 minutes.
Yeah, if there's one thing I could have talked about more than anything, would have been posture. So,
Wow. How much more stress and weight does the angle caused by looking down at our electronics add to our posture?
I'm going to answer it not directly, but I don't see why my answer isn't correct for your question. When we do x-ray the spine and we take a side view of the neck, and I make sure the patient is standing in their comfortable upright position with their eyes looking straight ahead. So that's the closest to their perception of normal as possible. And we see a way we can measure it, that we can still see an anterior head carriage. For every 20 millimeters that the head is forward of its correct position, it adds 10 pounds to the weight of the head. The hard part about understanding that is it's hard to perceive that because we're always carrying around a 10-pound head to begin with, and it doesn't feel like 10 pounds. Yeah. But the way that I demonstrate that is, especially if it's a woman, take a hold of her purse and I'll ask to borrow it. And even a relatively light purse is a pound or two. There's obviously some purses that are 5 pounds. But I say, look, if we hold that at our side with our body in upright position, standing, and our arm at our side, it's not that hard to hold that weight. But if we extend it out in front of us, all of a sudden now we're engaging new muscles to hold that, and it gets a lot heavier even though it weighs exactly the same. So the same thing occurs when the head moves forward. We're engaging these muscles that have to support it against it falling forward in gravity, because it's no longer being supported by the upright axis of our spine.
Yes, wow. That's really impressive information. Besides nutrition and daily stretching and sitting up straight, what are some simple steps that we can incorporate to limit bone and cartilage deterioration?
One of the biggest health components, I run into a large group of people that their whole life they've just done whatever is in front of them. Doesn't matter what it is. And I'm always trying to help them understand that, their body's a machine that can wear and tear, even under optimal circumstances. It needs the proper amount of rest. It needs the proper amount of relaxation. It needs the pause. It doesn't have to go all 16 hours that we're upright and moving. It can be stopped and rested. And so the pace of life, so many patients tell me, if I don't do it, no one's going to do it. Or how's it ever going to get done if I don't do it? And what always runs through my mind is, I don't know, but who's going to do it when you're gone? So it's really a matter of how you prioritize, how you reserve your health. And the design of our body is not to be under constant stress. It's designed to accelerate, decelerate, meaning power forward, slow down and rest, powered forward, slow down and rest. I remember talking to a friend of mine who's a cardiologist, and he one time was talking about going on a treadmill for an hour at a certain pace is not the best cardiovascular exercise, because the heart's not designed to do that work. It doesn't have to do that work in real life. It walks along and then it sprints up a set of staircases and it walks along, but it's not running staircases all day long. It's kind of that mentality if you get it in your mindset that way. We don't have to run 60, 70 miles a week if we're a jogger. There's reasons why people do that, but it's not necessarily for the overall health and well-being of their body. To more specifically, what I brought up was more about the overall decay of your joints, which is more directly to your question. Joint alignment is critical to that. If joints are not related to one another, they join together, two vertebrae join together. If they're not in proper relationship, they'll wear faster than the closest set of vertebrae that are in better tolerance with another. And then obviously nutritional support is good. But so many people, feel like arthritis is old age, can't do anything about it, got to learn to live with it, which is really a recipe for just letting it get worse faster rather than addressing wear and tear as a feature, both nutritionally as well as structurally. And if you focus on those, you're going to have joints that last you a long time. Patients often will tell me, doctor said it's old age. And I'll ask them, well, what about the ones that don't look like that on the x-ray? Are they younger than the other ones? They're all the same age. They were born at the same time. It can't only be how many birth years you are that have acquired to that. So what we'd be better off telling our patients is how to be aware of these structural weaknesses, how to correct for these structural, rather than just giving them a label and dooming them to being a victim of the word arthritis.
Thank you. That is wonderful information, and I normally try to relate how the human body works to a car or vehicle. You have to take care of it. It's not going to run without the proper gas. You have to change out the air filter, clean out the carburetor.
Yep.
You have to take care of your car, and the body is...
It's the same with our house. It's the same with everything, in our life, except we don't see our bodies the same way.
We just go and go. And I also use the terms slow and steady wins the race.
That's right.
That's right.
Wins the race. Little turtle.
Yes. So how has chiropractic changed over the past 20 years that you've witnessed?
Well, 20 years is not, in my career, isn't a long time.
Right.
And when I thought about that, I thought, well,
The reason I picked 20 is because they say every 20 years you can see what has happened in weather in 20 years.
Yeah, that makes sense. And I'm not sure. I struggle with that within chiropractic. But, to focus on that, I thought about it and I thought, my son, first of all, Dr. Ryan, is a chiropractor. He and I graduated exactly 30 years apart from Palmer College. When I visited him at school, and I went to some of his classes, and I became a patient of his in the clinical rotations he had to do with. Very little in 30 years changed. The academics has changed, the requirement to academics has changed, but the actual educational steps of practice, unfortunately, in my opinion, changed very little. Outside of the academic part of chiropractic, there's always been a wide array of offerings by many good, mostly chiropractors that have developed techniques. All chiropractic techniques have pretty much come from a previous chiropractor, whether it was from the 1920s, the 40s, the 60s. There are very good inventors that are chiropractors, and they've gone the extra mile to develop technologies and things that, unfortunately, again, I say it unfortunate because I think it belongs to be in development in the schools, and it's not being developed as readily in the schools as it is outside the schools. Modern technologies such as computers have been utilized to offer computerized instrument adjusting. Techniques such as infrared thermography has been helpful. Thermography and thermographic readings have always been a factor within chiropractic for measuring nerve interference associated with the autonomic nervous system. More modern versions of the same technologies is probably the biggest change. And then obviously things like insurance has changed, maybe the availability or the normalcy of the care versus, again, 40 or 50 years ago, where it wasn't so mainstream, but those that chose to go to chiropractors loved it and would never turn back from it. It just wasn't mainstream. Modern day healthcare practices, your primary care physicians are more inclined to recommend chiropractic care. I don't think it's made the big step to where they are recommending specific chiropractors or chiropractors that are part of a community that they've certainly heard of because of the fact we're sharing the same person in our patients. Most of the time they'll say, have you tried chiropractic? Or you might try chiropractic, can't hurt, something like that. So it's kind of off the cuff, kind of a referral. But, when I first came out in the school, It was the exact opposite. They were deterring people from going to chiropractors for no good reason other than, their own level of scientific ignorance, I guess. But today in modern medicine, in the world of the insurance company, the insurance carriers want to make sure the patients have gone through weeks of conservative care before they give more aggressive care, whether it's medication therapy or whether it's surgical therapies or surgeries. Again, the physician might say, well, we can send you to the pain clinic, or if you want, you can try chiropractic. And unfortunately, that's kind of the area that we're lumped into, but it really is a very, very tip of the iceberg of what we have to offer. Thankfully, once the patient gets to the office, most of the chiropractors know how to handle it and share that information in the world of chiropractic health with them, and it enlightens them. And I feel like they always wondered, what else could I do to help myself? They didn't even know which way to go. And when they find it, their eyes open up wide, the light bulb goes on over their head, and they finally make that connection with what they've looked for.
Yes.
So,
That was a wonderful way to put that all together, to make it make sense for what people do or do not know about chiropractic. I was one of the lucky ones who was introduced to chiropractic even as a child.
right.
So I knew how valuable it was for wellness,
Yeah.
because I don't want to feel bad.
Right.
So I would rather be in a care plan ahead of time instead of allowing it to manifest to a really serious situation or debilitating situation. Any other words of advice for our listeners?
Oh my.
Or a really good joke?
No, I don't have a good joke. I'm not an improv joker, so it doesn't come off my head too well. But no, I mean, I appreciate the time, and I know you're going to share this with lots of people. Types of patients that we see are very similar in their inquisitiveness towards how can they be healthier, how can they steer their bodies away from a life on pharmaceutical medications and resolve issues naturally. I will share this, the body's self-healing, it's self-regulating. If you remove the interference and you give it the fuel in the nutrition, the body works for itself. It will reset itself, it'll find the way to ease itself through nature.
Very well put. Thank you very much.
Well, thank you very much.
Yes, I am sure our audience appreciated everything you had to say. And for the audience, I have a call to action. So the next time you are not feeling well, or you have those bumps or bruises, or even you just trip and you find yourself feeling a headache or just not so well, not as much energy, please consider chiropractic treatment to help align, because even the smallest trip, fall, even for a child who starts having headaches that falls off a swing,
Exactly.
you have no idea what has actually happened to disrupt blood flow and nerve endings inside the body. So the call to action is, when you are not feeling so well, maybe give chiropractic care a try and see how well it works for you. And please join us again. So until the next time, wishing you the very best.